Welcome to Stay on Track podcast with Poolson Oden Law Firm. Along with my amazing co-host, Melissa Oden, I'm Danny Poolson. And today we're airing episode 4 of Stay on Track podcast with Poolson Oden Law Firm. And we are discussing today advocacy in medicine. And we have with us a very special guest joining us, Melissa Sayles.
Yay. And this is a topic that's definitely near and dear to your heart, Danny, and something that we talk a lot about in the office. So can I tell them a little bit about Melissa, partner?
Love it.
Okay. And I'm going to read this because Melissa's credentials are amazing. So she's a registered nurse who's worked in many different disciplines ranging from pediatrics to rehabilitation to nursing homes. She's been a supervisor, a review nurse, an assessment nurse, and a case manager. That's amazing. And currently, Melissa, we're blessed to have her as our medical records coordinator for Poolson Oden Law Firm, where she maintains and manages the medical, the billing, and the imaging records for all of our clients. Again, I could talk about you all day, Melissa, and all your credentials and how awesome it is that you're here and with us and everything that you've done for patients. So anyway, you're here. Tell us something.
Happy to be here. So I've been a nurse since 2005. And like you said, it's ranged from pediatrics to long-term care to working on the other side in insurance. So I'm glad to take all of my medical background and put it to good use.
Out of all the jobs you've had, what's your favorite?
Good question.
My favorite? Here.
Okay. Did you have to say that?
No.
For the viewers and the listeners, we do not have anything pointed at her for her to say that.
Yeah. Okay. So what's been your second favorite job?
My second favorite job, I have to say, would be working in a long-term acute care rehabilitation center. I got to take care of a lot of patients who ranged from being on a ventilator, seeing them come off the vent, and rehab and to go home. And that really feels like I fulfilled my job. I got these people in, got them out, they're healthy. So, yeah, that would be my favorite part. Second.
So when I think about patients, I think of this may sound weird, but I think about Humpty Dumpty, right? Humpty Dumpty falls off the wall, he falls apart, and then the medicine is to help put Humpty Dumpty back together again. Is that a fair analogy, or kind of weird, or what do you think about that analogy?
Yeah, I guess you could say that would be a good analogy. That is our job, is people come in with complaints, and it's our job to figure out what is causing those complaints, those signs and symptoms, and it is our job as a nurse to advocate for the patient.
Advocacy. Mm-hmm. That's what we're talking about. And before we get into actual advocacy in medicine and some tips that you're going to share with everyone today, we want to hear a little bit more about your story, if you will. You're in the proverbial hot seat. Carissa, you've been in the hot seat before, yeah?
I have.
Yeah?
It's amazing.
It's getting hot in here.
Yeah, almost. But in all seriousness, it's almost cathartic, right? And so we understand you may, as not just a provider but as a patient, been wrestling with medicine a little bit recently, and if you would be so bold to share your story with us and our viewers.
Yeah. So I have been suffering with some signs and symptoms for the past year. I went to some doctors. They did some lab work. They ordered a couple tests. And then I had another follow-up appointment. Well, at that follow-up appointment, the doctor was like, let's run some more tests. And I was like, well, no, we've already done x-rays. We've already done lab work. Can we do something a little more in detail? So I got her to order me a CT. And then it was another invasive procedure that I requested to get done. And so once that was done and we figured out what the problem was, I was able to get my symptoms under control and have a healthier, more holistic life.
And so running through that for us, thank you for sharing that. It sounds like there was a little bit of follow-up from you as the patient with next best steps for your medical treatment, rather than maybe your providers laying out every single step that could be taken to figure out what was going on to then sort of put you back together again.
Right. And I kind of feel like if I didn't have the medical background, I wouldn't be able to bring up those questions to go into a further diagnostic test.
Melissa, you bring up a good point that with your background, you knew like maybe some of the questions to ask or the tests that you may need, right? That
Yes.
you may have ordered for other patients. So what, and I might be jumping ahead, partner, but what are some things that you would recommend for people that don't have that background? Like what should they do if they continue to have symptoms and maybe they're not getting any better? Like how do they talk to their provider to get some of the treatment that they need?
One of the things I can recommend is to ask questions. That's a big thing. I feel like patients don't have, and they feel like they can't ask their doctors questions. Mainly the question is why? Why are we running this test? Are there other tests that we can run that are more invasive to figure it out? And I feel like that just comes with the provider's job is to educate, whether it be the doctor, the nurse, the medical assistant. Those people are there to help educate you as well because it is your healthcare, it is your life.
Were you frustrated with your process?
Yes, I was very frustrated.
Okay. Can you talk to us a little bit about that?
The frustration was mainly they just kept giving me medication to mask my symptoms, and obviously I wasn't getting better. And it was a frustrating process to get someone to listen to me and actually take me seriously. And it's like I hate to throw the nurse card out there, but I had to. And, you know, not everybody has that background.
No, that's such a good point about having to kind of use your credentials. And I think what I wrote down is listen, and being one of those folks out there that doesn't necessarily listen that well, right? It's important for patients to make sure that their providers are listening to what they're saying, and they're explaining exactly what's going on with their body, right?
Right.
And I think today, hopefully, Melissa, we can share some tips for folks who don't have your extensive medical background to feel more comfortable when they're talking to their medical provider and explaining things that are going on with them to make sure they can sort of be put back together again.
Mm-hmm.
Yes.
Yeah. Let's talk about a little bit of the terminology to understand the steps of treating a patient. I've heard the term SOAP thrown around by medical providers. What is that, and can you tell us a little more about that, please?
Okay, well, SOAP stands for subjective data, objective data, assessment, and plan. So your subjective data is going to be what the patient tells you. That's going to be your complaints when you come in, your signs and symptoms. The objective data is going to be measurable data. That's going to be what the doctor sees, does a physical on you, images, x-rays, lab work. That's your objective data. Then your assessment is going to be taking all of the subjective and objective data and coming up with a diagnosis to treat. And then the plan is how are we going to attack that? How are we going to figure this out? And how are we going to treat it?
Excellent. A lot there. So let's unpack that a little bit. When we're talking about subjective, that is basically the history that the patient is giving to his or her medical provider.
Correct. So that's like if you have knee pain and you go into the doctor and you tell them, I've been having knee pain, I have been trouble walking, I can't stand, it's been hurting for 3 weeks. And usually the doctor's going to say, well, was there an injury involved? And then you go from there.
Being very specific and intentional about reporting all the symptoms you're experiencing.
Correct.
Okay. And one of the tips that Carissa and I give to our clients is to bring a spouse or a relative or someone who knows you with you, who understands your symptoms and can help give the history to the doctor to make sure that the doctor, the medical provider, understands the whole world of symptoms and you're not leaving something out. Yeah.
Yeah, exactly. I mean, I think that's important for all of us, right, Melissa? I mean,
yes.
Yeah.
I also advise to write your symptoms down. If you've been dealing with this for a while, keep a log of when do you have these symptoms? When is it more relevant? Mornings, evenings, afternoons? What causes the pain? What causes these symptoms more?
That brings up a good point. We talk in our office often about failing to prepare is preparing to fail. Mm-hmm. And what it sounds like what you're saying is prepare for your office visit by taking notes, putting down sort of a log or a timeline to then be very clear when symptoms started, when they stopped, to give a clear picture to your doctor.
Correct. Yes, you want to be able to go in and explain everything to the doctor so he gets a better understanding. And also, any questions you may have, write those down so you don't forget to go over that with your doctor and your healthcare provider team.
Excellent, excellent.
I think you can have I know my life with my husband, like I'm like, you need to write all that down. He's going to look at me like, what? So I can help with that, right? Like, yeah. I have a little journal. I'll write those things down for him and then questions that I would have. Because then, if I'm not able to go, at least I know, he has those things to talk to the doctor about.
Right.
And talking about husbands, and I don't mean to pick on the dudes out there, but we've seen time and time again where, and it's not just men, right? Women do it too, because women are extremely tough and deal with pain probably better than men, right?
Yes.
Right? God bless.
Like, yes.
100%. But in all seriousness, so you go to the doctor and there's just this sort of feeling sometimes where you don't want to share or be vulnerable or say something that's too much or anything like that. And Melissa, talk about this a little bit, how important it is to put all that aside, quit worrying about all that, and make sure you're open and honest and 100% transparent with your medical provider to make sure they know everything. Because if they don't know everything that's going on, they don't have all the information to then help put together a good assessment and plan.
Correct. Yes. Definitely be open and definitely tell your providers everything. And if you don't feel comfortable telling the doctor everything, tell the nurse, tell your medical assistant. There's other people in the team that may be able to speak up for you as well.
Excellent. Another tip when you're going to the doctor's office, and we tell this to all of our clients, is to be pleasant, be calm, always, even if you're in pain, even if you waited in the waiting room for 60 minutes or 90 minutes or 120 minutes, right? Even if you waited for a long time, which we know, unfortunately, is become part of the practice of medicine, is that kind of wait time. Even if you've waited, the time to share those grievances is not when the doctor walks in.
True.
Right.
Yeah. What have you seen with that, Melissa? If you could tell us, like, if that has happened, how does that kind of get the whole appointment maybe off on the wrong foot, even with the doctor or the professionals that are in there to help?
Well, it's like with any type of customer care. If you go in and you're hot screaming, it's going to put a wall up. It's going to be like, wait, it's our job to take care of these people, but it's going to make the conversation of your symptoms a little bit more hesitancy, I guess.
No, I think that description of a wall up, that's a good one.
Yeah.
Yeah, it sort of impedes the communication between the patient and the doctor. And I think when we're talking about sort of the background of medicine from the function of an office, maybe talk about that a little bit, where the doctor isn't actually the person putting you on the schedule. The doctor isn't in charge of logistics, right?
Right. One way to look at it, too, is maybe your doctor is spending a lot of time with other patients, trying to figure that out, trying to figure out their healthcare problems as well. You don't want, to be walked in and turned around within 5-10 minutes of your visit as well.
That's such a good point, making sure that the doctor is spending the time with you to understand your symptoms and what's going on with you is just as important as that doctor spending time with his or her other patients.
Right.
That's a good point. Going back to taking your time to explain all your symptoms, I've heard a phobia or fear of white coats, where people are just sort of just intimidated by the white coat. Being, a medical professional who's worked with doctors, talk with us about put that aside as a patient and just be straightforward and direct and just speak with your doctor.
Right. So when I first started nursing 10 years ago, we had to wear all white. And then that changed to wearing colored scrubs because of this white coat phobia. People see you come in, it's like, whoa, what are we doing? So yeah, that is a thing. But you have to realize that they're just humans too. They have their own issues, and there's nothing they haven't seen or heard before. So.
Excellent. So for folks who don't have a medical background, something we've seen often in our practice is a client may tell us, I didn't think that was important. Oh, I didn't think you needed to know that. Can you talk a little bit about the importance of laying it all out there, even if the patient doesn't think it's important, to make sure that the medical provider knows it, or how to maybe balance what the patient thinks is or is not important and what he or she should or should not share?
I think honestly, everything, you should share everything with your provider. Even if you don't think it's important, let your doctor tell you that, like, okay, well, this symptom is not related to that. Or, I'm glad you did tell me that, because, you do have other symptoms that correlate that you may not think are involved with that body part. It's called like deferred pain or other things. So, it is important to share every little detail with your doctor.
Excellent, excellent. So after communicating with the doctor, subjective findings, history, you talked about objective data, which would be the tests and the imaging and things like that.
Correct.
Any recommendations on the patient when it comes to objective tests and what the doctor's recommended, or in some cases, maybe what the doctor is not recommending, and maybe asking the question sort of like you did, doctor, are there any tests? Is there any objective data you can get to help figure out what's going on with me?
Right. So if a lot of times with certain injuries, the doctor's going to want to order an x-ray first. And then some x-rays are not definitive to meniscal tears or any muscular issues. And if you feel like it's not a bone issue, then speak up and say, well, why can't we get that MRI? Why can't we just order the MRI so I'm not having to do an x-ray one day and then an MRI 3 weeks later after the fact?
And you've kind of jumped into another topic that we've seen quite a bit, both professionally and personally, health insurance.
Yes.
Where there are tests that are ordered, but then after the fact, you may get a phone call as the insured, as the patient, from your insurance carrier, who then asks you, why are you getting these tests? Are these tests necessary? This, that, and the other. Melissa, can you talk about the importance of listening to your doctor's advice and then following through with what your doctor's telling you to do, even if your insurance carrier is questioning the importance of those tests?
Right. So when the doctor does order these tests and the insurance company wants to know why they're trying to argue, is it based off of medically necessity? One of the things is you can get your doctor involved. There are things called peer-to-peer reviews that can help get things going a little faster. I've seen that on the insurance end, where I've had clients call, doctor's offices call me wanting to get certain procedures pre-certified for the insurance. And I'd say, well, based off of medical necessity, I have to request those records to make that call to say, yes, I believe this is medically necessary. And sometimes if I can't find the data, then let's talk to your doctor. And then I have the doctor talk with our medical director on the insurance side. And then usually the doctor will be like, yeah, I can understand. I can see why we need to get this ordered.
No, that's a really good point. And again, we talk about this as well, not hesitating or not waiting. And when it comes to medical treatment, Melissa, tell us if you agree with this, but as a patient, you want to be proactive and aggressive to finding out what is going on. You don't want to rush into treatment. You want to rush into identifying the diagnosis, the prognosis, the assessment, and then making sure that whether it's an insurance carrier who's objecting to the treatment, or the facility's not allowing you to schedule it, or whatever hurdles may get in your way, that the patient, that's the advocacy part, right? You're being proactive to make sure you're addressing it, because heaven forbid something benign is going on. The longer you wait or the longer you delay the treatment, the more difficult it is to put you back together the way you were before whatever was going on with you medically.
Right. That is completely true. You definitely want to follow through with your doctor's orders. If treatment is ordered, get it done. And then so that way your doctor can reassess the injury after you complete that treatment.
So I think of it as it kind of goes both ways, right? Where when we talk about advocacy in medicine, if you have a provider that isn't as proactive as you want them to be, where you need to be voicing that, or someone, your spouse, a relative, is voicing that, but at the same time, if your medical provider is giving you direction and instruction on how to get better, you as the patient, you need to hold the vine, and you need to do what your doctor's telling you and make sure you're taking every step to get better.
Oh, yeah, definitely. Like if physical therapy is ordered and you're not going, well, then that explains why you're still having these issues.
Okay. And then when we talk about the actual treatment itself, do you encourage the patients to ask why?
Yes.
Yeah.
Yes. I believe every patient should know why they're doing certain things. And that's one of the things as a nurse, that's what we were taught to do, is you explain to the patient, I'm doing this is why, this is what's going to happen, and this is what to expect type of situation.
Any reason for a patient to hesitate at all to ask any question to his or her medical provider?
I think a lot of patients have like a fear about asking questions with their providers, with their doctors, and it's just more of the fear of the unknown. Either I don't know what to ask, or am I going to sound silly asking this question? And I just encourage everybody to ask questions, to stand up for yourself. This is your body, it's your life, it's your health.
That's a great point, because I think in this this land that we live in of being able to Google, right?
Oh, yeah.
That you can Google anything, and it's always like the worst thing ever, right? I think some people may not want to ask because they're scared of what that answer may be.
Right.
So, but you would recommend, right, to just ask so that you can even maybe have some peace that it's not what you think it is, or even if it is, being able to deal with it.
Right. Definitely.
That's it's the fear of the unknown, right? Where that fear, and a lot of times on the other side of fear is just clarity. And it's just knowing whether it's a good fact or a bad fact. It's better to know it, because then you can be proactive and address it, right?
Yes.
Okay.
Right. And the other thing, Melissa, I thought would be important for maybe the viewers to kind of us to talk about and know, even if you're feeling better, right? Should you continue to go back to those appointments? I think, Danny, you have some experience like with your dad. Unfortunately, like you want to go and get checked even if you're feeling great again.
Oh, yes. Definitely keep those follow-up appointments, even if you're feeling better. And that's something that you can tell your doctor, I'm feeling better, and that, let them know. That's great. But continue the follow-up appointments, definitely.
Yeah. I don't, it's tough for me to talk about my dad. I don't know if this is appropriate.
I think that it is.
You think it is?
Definitely,
yeah. I mean, this is.
If you're comfortable talking about it.
Yeah, Melissa. Yeah, just is that okay? Or yeah. No, I think the follow-up appointment. I get moved to tears when I think about this, but basically, my dad. For folks who know my story with my pops, he passed away from bladder cancer. But anywho, I don't know. So he had some symptoms, and so he went and got checked out. He got prescribed medication, and the doctor scheduled a follow-up appointment. And he took the meds, the symptoms resided, and he didn't go back to his follow-up appointment. Time passes, months pass, year passes, his symptoms return, he goes back to the doctor, he's got cancer. Anywho, his prognosis was poor, bladder cancer, and he ultimately passed away. And so whether or not missing that follow-up appointment, could he have caught it? Would it have been sooner, right? I think pretty much probably every single person listening to this has had some cancer in their life, whether it's themselves or a family member or a dear, near friend, right? I mean, we've all dealt with that. And so it just hits home with me with the follow-up appointments, because and the proactiveness and making sure you're staying on top of it, because it's very normal. The symptoms go away. Why go back to the doctor, right? Why go back to the doctor, right? I mean, how many people don't follow up because I feel better, I'm fine, right? And so very, very tough set of facts there, and we'll never know if him not going to the doctor. But what we preach a ton, and Melissa, appreciate you sharing, is that proactiveness, just to make sure you follow up and follow through and show up for your appointments, because if something is going on, the only way to find out is to show up.
Right.
Yeah, and I think people, they don't want to go back because they don't want to be at the doctor, right? It's like, I feel better, I'm good. I don't want to have to take the time out of my day or my life. It's it's a lot, and especially if it's something that you've been worried about, you went and Googled, or you're scared. Like, it's like, okay, I feel great, I don't want to do that. But I think it's important to just get that clean bill of health, right, as much as you can.
Definitely.
Okay.
And for Google, right, it's such an easy tool. Not that we're plugging Google, but to look stuff up. Maybe, Melissa, would you agree that even if it's scary, you want to know, you want to learn, use the Google as an educational tool to then bring those questions with you to then ask the doctor, not in an impugning way, but in an informative, hey, is this, is this that, to make the dialogue go, to have the doctor explain to you exactly what's going on.
Right, and definitely have them explain it to you in more layman terms and not the medical terms. That seems to be a big holdup, is a lot of people and doctors want to talk to you like you understand what this medical terminology is. And so I think good resources is like the Mayo Clinic. They always have good materials there that you can ask your doctor questions.
Well, Melissa, you have been a tremendous guest. Really enjoyed having you. Carissa and Melissa, I appreciate y'all allowing me to talk a little bit about my pops, even though kind of emotional. So I appreciate it, and I'm also a little mad at each of you for making me do that, right? Right?
Don't be mad.
No, I appreciate it, Melissa. So we talk about tell us something good, right? Mm-hmm. So as an au revoir, Melissa, tell us something good.
Something good?
But you're right on the spot.
For what it's worth, we have a script, so you knew it was coming, Melissa. Come on now. Come on now.
It's true.
Tell us something good.
Something good. I'm a grandmother now. Yay. That's amazing.
Yeah. Oh. Yay. And how's the baby doing?
Oh, she's doing great. She's 3 months now, and she's cooing and cawing and having conversations, and she's growing. So
that's awesome.
That's exciting.
Do you have a name as a grandmother?
Yes, I do. It is Gmaw.
Gmaw. Lizzie, do we have something for Gmaw? Something.
I don't think so, but I can get something.
What about a Joker laugh? Let's put a Joker laugh in there. That kind of fits, right? Gmaw. Lizzie's shaking her head. She's like,
no, that's like
no. Lizzie, how was Melissa? How was Melissa as a guest?
I thought you did a great job.
Thank you.
Yeah.
You did do a great job.
You did.
Mm-hmm.
You did.
Thank you for all the tips for the listeners. I think that's helpful.
I might call you at my next doctor's appointment and make sure I do it right.
Right?
Yeah. No, for sure. And to all our viewers out there, if there's any other topics or anything interesting that you want to hear more about, or any guests you'd like us to have, we always are open to hearing that, and definitely want to take that for any new future episodes. But for for everyone listening in, thank you very much. For my amazing law partner Carissa, our production Lizzie, and our special guest Melissa, thank you very much for staying on track with Poolson Oden Law Firm.
See you next week.